So, what can you tell us about individual and family approaches, evidence-based individual and family approaches um, to domestic violence treatment? And what have you found to be most effective with this population?
There's not very much that's been done in terms of research on individual therapy. State laws that regulate domestic violence treatment programs for court-ordered offenders do allow for individual therapy. It's at the discretion of the treatment provider and the local probation department that regulates these programs on a local level. But there's very little research that indicates whether these individual treatment is superior to or inferior to group treatment, and for whom it's best used for. Chris Murphy and Chris Eckhart are two notable researchers who wrote a book on individual work with domestic violence offenders, and their research suggests that individual therapy can be very effective and useful for a number of individuals, but they don't have any research that's indicating that individual treatment is significantly more effective than group. At least we don't have that information yet. Regarding family and couples treatment, we have a lot more information on couples treatment that does show that it is effective in reducing rates of domestic violence. It's also as safe as group work. Specifically, 3 or 4 well-designed studies using random assignment to conditions, which is level 1 research, indicate that couples counseling is as effective or more effective than group. The caveat is that so far these studies have used populations of men who had been arrested or were voluntary clients for perpetrating lower levels of violence as opposed to men with severe violent history. So couples treatment may not be appropriate for men or women who have severe domestic violence histories and are extremely controlling, for example.